This video is about my residency program. I'm gonna give all the details, pay, the schedule, like everything. I'm just gonna do a full-blown breakdown on my new grad residency program. Hi guys, my name is Tiandra. I'm a new grad registered nurse. I was an OBN and I also have my cosmetology license, and I'm a mom of 2. This channel is about nursing, life, beauty, being a nurse and a mommy, and how I juggle everything at the same time, and just transitioning into my nursing journey. This channel is called Nurse C's Journeys because I really just want everybody to go on this journey with me. Like, every update is going to be as I'm going through it. So I really want it to feel like you're on this journey with me, and I'm giving updates about what's going on next, and it's just kind of like we're in this together. So like and subscribe if you're interested in any of that. This video today is just going to be an update. I have been gone for a long time. I know I said that I was going to upload every week, and I was doing that, but it was so overwhelming to do it with me just starting work. So I'm going to try to get back on track. But I've seen all of you guys' comments, and I've seen a bunch of comments about like, when am I gonna come back? And I love that. I'm gonna try to be more consistent with it. This video is about my residency program. I'm gonna give all the details, pay, the schedule, like everything. I'm just gonna do a full-blown breakdown. So I started my residency program on June 5th. So I'm going on 2 months into my residency program. So far, I really love it. When I first got hired, I did a bunch of like YouTube searches, you know, about like residency programs. And I see like a lot of people hating it, and it scared me, honestly. Like, you see people like, I quit my residency program. I hate my residency program, you know, and it was kind of like disheartening. So I really wanted to do this video for people that maybe they got scared too, to show you that like, I'm not having a bad experience. I actually really love the hospital that I'm at. I love the way the program is set up. So I want to just break it down for you guys to see what you're looking for, and maybe these are the things that you can look for in your residency program. So like I said, I've been in my program for about 2 months now, and to break down the timelines, a full year to be in the residency program, but I'm only following a preceptor from June 5th when I started to August 25th. So it only comes up to about 3 months of like following a preceptor, and then I'm on my own. So the way the preceptorship works is the first couple of weeks, like maybe the first 2 weeks, you're just shadowing. You're just watching them, seeing how they create their routine, seeing how they chart. Just like, you're not really being super hands-on, you're just kind of watching. After the first 2 weeks, then you're gonna go into your like married phase. So married basically means like you stay with your preceptor and you're helping, but you're not alone. Like, you're never gonna be alone the whole time. I'm assisting my preceptor. I'm learning how to take on all of my patients, but I'm doing it slowly. So maybe the first week I'll have 1 patient by myself, and then the second week I'll have like 2 patients by myself. I moved up to 4 patients pretty quickly. I think it took maybe 2 weeks for my preceptor to like trust me enough to just give me my 4 patients, which I actually really love, because when I'm by myself after August 26th, I don't want to like feel like I don't know anything or I'm not prepared to take on 4 patients by myself. Mind you, I'm in the cardiac tele unit, so our ratio is 1:4. So at the end of the preceptorship, you should be dealing with all of your patients by yourself. Not by yourself, because like the preceptor is gonna be there when you're passing meds, when you're charting, they're gonna be checking all your stuff. But like, you're going to be trying to do it by yourself, so that when you are by yourself, you're not as like frazzled, you know, you're not as scared and nervous. So right now I'm in week 8 of my preceptorship, but I'm already taking care of my 4 patients. I already feel confident in my charting. I feel confident in my medication pass. I feel confident talking to the doctors, because I kind of threw myself in, and my preceptor was okay with trusting me, especially after I told her, like, I feel better if you just kind of allow me to do it. So honestly, it's really like work at your own pace and whatever pace your preceptor is comfortable allowing you to work at. So after those couple of weeks, you're on your own. You're not working with your preceptor. You are having all of your patients by yourself, and we're not doing the weekly classes anymore. So you're gonna be working 3 days at the hospital. I can't make my own schedule right now. I have to work with my preceptor on her schedule. So whatever she schedules herself, I have to work it. After August 26th, I get to create my own schedule since I'm on my own at that point. At this hospital, I can create my own schedule. The way that it works is seniority, of course, gets to pick first. So they open up the scheduling for a week period, and you'll have from Sunday to Friday to schedule yourself. People with maybe like, you know, they've been working there for a long time, they'll be able to pick on Sunday. So they'll be able to just pick whatever they want and it'll just be approved. And then like the least that you've worked there, the farther back you are. So since I'm a new grad, I'll have to pick on Friday, which is the last day of the like choosing period. So I'll get the shifts that's left over. But again, there's a lot of shifts. So I'm still able to like choose the ones that I want. The only downside about that is people with seniority, like they don't have to work weekends if they don't want to. Me, without seniority, like I should be working at least every other weekend or 6 weekend days out of a 6-week period. So out of those 6 weeks, I could work 6 Saturdays or 6 Sundays. As long as I have 6 weekend days within that period, then like I'm good. My schedule will be approved. But that's one thing that I really like about it is I love to be able to schedule myself. And working with my preceptor, I've learned I don't like working 3 days a week like consecutively. That is so exhausting to me. Like, woo! By that 3rd day, I mean just ready to go. Like, no. Unless I have something planned, like a vacation or something, then of course I would want to work my 3 days, get it out the way, and then maybe I can plan my next 3 days like far away so I can have like a lot of days off. Just kind of plan it to fit your life. So I really like that I'm able to plan and make my own schedule. And I won't be able to do that until August 26th. Like I said, the residency program lasts for 1 year. So after August 26th, I'm not with my preceptor anymore, but I'm still on the residency program, which means I will be having to take like mandatory classes every few months. I've seen a lot of other people on like YouTube say that they have to take it every month or they have to take it every week. I have 6 mandatory classes to take within that 12-month period. So it's once every 2 months. At the end of the residency program, I do have to do like a group project with the other students in my cohort, but it's not like, when I was doing the research on it, they were making it like, people were making it seem like it was really hard. It was a hard project or like it was really daunting. The way that they described it to me, it wasn't. It was like a PowerPoint, and we have to do a PowerPoint on something specific about our unit. So since I'm on the cardiac telemetry unit, our project will be something cardiac or like vascular. So it would be like a stroke, a heart attack, pulmonary embolism, or like a DVT. It's really just like school, honestly. It's not like anything crazy. It's just like a PowerPoint on something that we pick. And whoever is also hired with you on that unit, they join you in that project, and we do that at the end of the year. So I'll have to do that like June. And then once that's done, then I'm out of the new grad residency program. I'm no longer considered a new grad just because I have graduated from a residency program. So let's talk about money. Money. I'm in California, so every state's gonna be different. My pay rate right now is $45.83, but that's like the base pay. It's kind of weird. We have a bunch of differentials at our hospital. We have an evening shift differential and we have a night shift differential. So even though we don't have like an evening shift staff because it's 12-hour shifts, we still get paid an evening differential. So from 7 a.m. to 3 p.m. I get paid my base pay $45.83. After 3 p.m., so 3 p.m. to 7, I get paid the evening shift differential, which is like 3% more. It's nothing crazy, but like it does add up, honestly, because I can see it on my check. It's like a nice little bump And then of course, if you work nights, you get your night shift differential, which is 15%, which just sounds beautiful, but I can't work night shift. I'm not built for that. I would be sleeping with the patient, so no. And then of course there's a weekend differential. So if you work weekends, then you get the 10% differential. Again, it's not like a super high, but it is a good incentive to work weekends. Cause you know, I'm trying to be like where the money resides. I'm trying to get paid. You know, the more money, the better. As of right now in the residency program, I can't do overtime, which is really annoying. But after I'm done with my residency program, once I'm done on the August 26th, I'll be able to pick up overtime shifts. I'll be able to, you know, stay later if I wanted to. I'll be able to do whatever I want. Especially if I have something planned and I'm like, okay, I want to go on a vacation, or like I want, you know, to buy this product or whatever, I can always pick up a shift. After my preceptorship is over and I'm not considered a new grad anymore, my pay goes up. So I'll automatically get sent from 45.83 to 50. With the hospital that I'm at, we do get a raise every year that we work for them, and it's just like a couple of dollars. That'll be kind of my biggest raise because it's kind of getting like $5 extra. After my second year, I'll get bumped up to like 52. After my third year, I'll get bumped up to 54, you know, something like that. They really incentivize staying there and building your seniority there because they want to retain their nurses. I really love my hospital because I'm a part of the union. They really do fight for safe nursing to patient ratio. Once we get past 4, they will push the hospital to give us incentives to be out of ratio. I'm gonna touch on the modules a little bit. Like the modules that we do have to do, they're not hard at all. Mine are online, so I'm just reading like passages. I might take a couple tests here and there just to show that I am understanding, especially for my unit. Like we have our EKG tests, we have like stroke classes and certifications that we have to take so that they know that we're prepared for situations like that. But it's not like hard. It's really the stuff that you learned in school. So it's not like you're gonna be just hit with some random information. I really do appreciate them being online because you can get done fast and you could just be getting paid for the whole day, which is, I like that, you know? But that's really it about my my residency program. Like it's nothing crazy. All of the other reviews that I saw were like really bad, or they just kind of scared me away from getting into a residency program. But I can tell you now, I feel like I'm way more prepared than I would be if I just got like 3 weeks of training and was thrown on the floor. Like, all right, have a good time. No, I'm the queen of baby steps. I want to take every baby step I can. I want to feel prepared. And at the point that I'm in my residency program now, I do feel prepared to take on all my patients by myself. But I still appreciate that I have a couple more weeks just to hone my skills, hone my schedule, make like a routine for myself, and just kind of like gradually work my way in to where I need to be, which I really appreciate. So if you're thinking about joining a residency program when you graduate, I think it's a really great option if you don't just want to be thrown into the field, if you want to have a little bit more time to grow your skills and to kind of step into the water slowly instead of, you know, just jumping in head first. That's something that I appreciated. So if anybody else is thinking about it, I would say look into different residency programs. There's a bunch of different ones, especially in California. And I feel like now they're creating more residency programs because they see that they have like a better retention rate for new grads because we're not just thrown in, you know, we're not like afraid. So I think it's a good option. If you're thinking about joining one, then look for one, find one that fits exactly what you want. Like don't settle, find one that fits what you're looking for. I'm sure you're gonna find it. That's it for that. A little update about what I'm planning on doing next. I'm not sure if I touched on this on my last videos, but bedside is not my end goal. I do have my cosmetology license, so I want to utilize that and I want to like merge the two. I do want to become an aesthetic nurse. My end goal is to own a med spa and a wellness center. So to start that process, I am going to join an injector's course so I can get injector certification. I'm gonna work at the hospital for a couple days a week, and then the other days I wanna work at a med spa, build my clientele. I know there's a lot of other nurses that are interested in aesthetic nursing and injections and all that. So if you're interested in that, please subscribe, because like, I'm gonna do an update every step of the way. I'm really gonna work on being more consistent. I'm gonna update about my injector's course next, but then I'm also gonna update about, you know, working at the hospital as well. I'm also gonna update about how my life has changed so far as being an RN. I've been an RN for about 5 months now, and I already feel like I've had so many like changes. So I'm gonna update you guys about that. Just subscribe, because there's gonna be a lot of things coming, and I want you to be, you know, with me. Besties, you know. I've seen a bunch of comments that you guys want an update on the Nightingale video, so I will be doing that as well. I have a couple of friends that have just recently joined the program, so I'm going to be asking them about what are the new policies and what are the new rules. So hopefully I can update you guys about Nightingale pretty soon. But thank you guys for watching. Like, comment, and subscribe. Bye.